Welcome to another episode of a Rehab Diary, the series. And on today's episode, we have Dr. Chris Wainwright. Chris, welcome to the podcast.
Hello.
Thank you so much for being here with us today. I'm really excited to get into today's episode, and we're going to talk all things orthopedics. We're going to talk all things rehab, and then I guess the mental side that comes with that, and some amazing advice and education from someone who's just doing incredible things in that space. So before we get into it, Chris, we start every episode with the same question, and that is, what is mental resilience to you?
So mental resilience to me would be the ability to cope under adverse conditions for a prolonged period. So it includes the endurance, because resilience wouldn't just necessarily be you see a bad event or you suffer a bad event once and you go, oh, that's okay. Often, especially with some of the patients that we deal with, they've had multiple events happen and multiple experiences, and it's the ability to cope with those without suffering mental harm, I guess, and that can be manifested in any number of ways, whether it be anxiety, depression, other mental health issues, and physical issues. So that's what I would perceive it.
It's interesting coming from your perspective, because mental resilience it's not just, you would see clients where it involves the expected, but then also the unexpected. And then one thing that you touched on that was quite interesting is that sometimes it can be over a number of different episodes. It's not just one. So developing those habits early on, or at this, when you've got a chance to start off with, you can take that into future episodes or future points where mental resilience is required, and that's quite interesting coming from your perspective.
Yes, I mean, it's just the same as any kind of rehab or fitness program that you engage in physically. If you do the same things mentally, then you are less likely to suffer a mental injury if you are mentally healthy. So by doing, whether you go to a happy place at the gym, or whether you go for a walk with the dog, whether you meditate, whether you do any one of a number of those things, those are all exercises that help you to be fit and active and resilient to mental injury, as opposed to being fit and active in a physical sense by going to a gym and doing stuff like that, or participating in your chosen sport or activity. That gives you the physical resilience and the physical ability to cope with injury and stress and everything else.
Yeah, it's so interesting. And I think we're going to dive into a little bit more into the podcast soon about how that can be of benefit in recovery. So I'm excited to get into that. But tell us a little bit about you first, sort of what got you into orthopedics? What do you love about it?
So I had a knee injury when I first started at med school. So obviously that kind of made me look at that side of things. My brain is kind of hardwired to think about 3D structures and things like that. So for me, of all of the aspects of medicine, orthopedics probably came the easiest. And I'm not saying it's easy. I'm just saying of the aspects of medicine, that was probably the field that I felt I fit into the best. That was the best fit for me. So I started off as a normal junior doctor. Then in the UK, everybody has to do a general surgical training. So I've done my share of intensive care, my share of emergency medicine, my share of general surgery and cancer surgery and all of those things, as well as the orthopedics. Now, that's a long time ago now. It's historical, but it does give you a broader perspective on things than somebody who does basically 1 or 2 years as a junior doctor and then just goes straight into one career path. And again, when you're applying for different training roles and different positions, it's not a guarantee, So when you talk about mental resilience, we get knocked back. It's like, no, we don't want you. It's like, well, why don't you want me? Am I not good enough? And it's like, well, actually, compared to the other guys, no, you're not. And so to hear that from somebody, from most people going to medicine are kind of type A personalities and want everything to be perfect, want to do everything right. And for somebody to say, well, actually, the other guy's better, right? That's something you have to learn to cope with. Otherwise, you'll curl up in a ball, basically. You can't, yeah, and leave the profession. So there are knockbacks mentally there. Fatigue, and you talk about recurrent uh, injuries or insults. I'm from the bad old days when we used to do 70, 80-hour weeks every week. And so the physical and mental insult of that is draining as well. So you have to learn techniques and tips and tricks of, if I'm tired, what can I do to make sure that I don't make a mistake? Because if I make a mistake, then somebody's hurt, potentially. So, yeah, there are lots of things that you have to explore in that space to promote physical and mental resilience for fatigue as well as for injury.
It's very interesting because when you put it like that, and I know, especially with a few things that I've gone through, when someone is going through mental toughness or resilience, your own personal stories allow you to kind of guide patients because you've experienced some level of mental toughness. It allows you to take what you've learned and then put that into practice with your clients when they're going through things after, even though it is a bit different, but it's that same mentality of mental resilience. So you are doing a little bit more stuff in the army now as well. Tell us a bit more about that.
Yeah, so obviously being in something like that requires a commitment. And so as a trainee, I'd moved something like 27 times in 25 years before I finished my training. And you can't really commit to an organization or something when you're moving around that much. So never really had the opportunity while I was training. So it was only when I actually became settled in one place as a surgeon that I could go, right, what do I actually want to do here? And the Army were advertising for orthopaedic surgeons. The opportunity came up, so I decided to change tack from the public space in the public hospital system to giving back through a public service to the Army instead.
That's quite amazing. Do you find there's been challenges associated with incorporating that into your practice or going down that road?
You mean like breaking my shoulder? Yeah. Just to explain that. So when I was doing basic training, we were doing some PT, some physical training. I had a fall and injured my shoulder. I did all the right things, which is ignored it, tried to carry on, then did my rehab, did my physio. It wasn't getting better, so we eventually got it scanned, realised something was torn in there and wasn't going to fix itself. So that obviously had an impact on my ability to work at all. So I've had to take a step back from Army recently just because I wouldn't pass the fitness test. So taking a little step back there, but I should be kind of finishing off some courses again later this year. And yep, surgery went well, rehab's going well. It's about 60, 70% strength at the moment. Hopefully it'll be 100% near about the 6 to 9 month mark. It's only 4.5 months now.
It's going to be good to hear what you've got to say about a few things we talked about today, given that you actually are, recovering or getting to that 60, 70% of your recovery journey too. So it'll be interesting to see, because I think sometimes outside of just what's associated from pain or restricted movement or loss of strain, there's also the external that comes along with that. And for you, that's going to be things like, not being able to work or that mental kind of, I think when you're so used to helping people every day, but then that gets sort of taken away for a period of time, sometimes you can struggle with that kind of stuff.
Yeah, so talking to patients, silly things like, patients come and say they've got an issue with both of their hands. And you'll say, well, we can do an operation. And they're like so scared that somebody else will have to wipe their bum for them. Right. Mm-hmm. And so that fear of powerlessness is huge for everybody, whether they're having major surgery or minor surgery. So you need to be able to reassure people that, no, you're not going to be, a cripple. You're not going to be completely dependent on somebody else. There are things that we can do. There are things that we can help with to allow you to not feel helpless.
Yeah, exactly. It's those sorts of things when it comes to these big sort of, I guess we could say, life-changing events for people, that when we consider rehab, it's very step by step. It's week by week. It's we've done it a bunch of times. But what people are considering is the feeling associated with it, the emotion associated with it. I can't play with my grandkids, or I've, like you said, I can't. Someone's got to wipe my butt. Like it's there's so much more. And I think that's where that holistic approach, but making sure that we are doing things or considering someone's mental state, that's how we can actually help with those really important components.
Yeah. When we interview patients for who've had injuries at work, for instance, um, we do have a standard questionnaire that we go through for all of those patients. And the last one, so we go through how does it affect your work? How does it affect your activities outside of home, your social activities? How does it affect your ability to look after the house? Can you look after yourself? And then the last one is, how has it affected you mentally? That's part of our standard screening for all patients who've been through these kinds of injuries, because it does form such a massive part of it. If you're not looking after the whole person, you can have a perfect surgical result. But if somebody's not engaged in their rehab and doesn't want or can't see the need to do an exercise, then they're never going to recover. So that surgery is all risk and no benefit then, which is no good to anybody.
Exactly. And do you find, and this is just a question, but do you find that the more, I think there can be a bit of a stigma, right, around when we speak about mental health, is that people think someone has to maybe be either mentally struggling to beforehand or have some sort of mental health condition to struggle through rehab. My question to you is, do you find that the more, let's say, or the more someone doesn't feel they have anything to worry about mentally, the more they can struggle because it's so far from their normal?
I think there's some classic different responses. There's, it's almost like the grief reaction. There's people who are angry that they've got to do it. There are people who are in denial, no, I'll be just fine. There's people who accept it. And, that's, as you know, the final stage of grief. So when people do come around to accepting, look, I'm actually going to have to do this, you still get the people who come in and do the bargaining. Oh, well, maybe if I just do this instead, is that okay? Well, no, it's not. You still have to do your rehab. You still have to do the exercise. I've taken now more recently to framing it differently. And I'm doing two things now. So everybody is busy. So I have to find time to do my rehab, my exercise that I need to do to maintain my physical and mental fitness for work. So I have arranged to do that before I start in my normal working day. So I'll have my brekkie, I'll go to the gym, I'll take my child to school, I'll do whatever I need to do. Then I'll go to the gym and then I'll start work. Some people are night owls. They would rather go to the gym in the evening. Good luck to them. I can't do that for toffee. It doesn't work. So I go in the mornings. I now take my gym bag into work with me and leave it in the corner of the room, so that when I see patients talking about the importance of rehab, I can literally point to my bag and say, there is my gym bag. I've been to work to the gym this morning to do my rehab. I can't do that for you. That's a you thing to do. My part of the deal is I fix it. Your part of the deal is you make it work afterwards. So that's part of what I've changed recently. The other thing is, instead of describing it as rehab, because people think of that immediately as it's a finite thing I have to do after my injury, and then I'll be forever sweetness and light. Sadly, it would be wonderful if we could all just go hard at the gym for 2 years, and at 21 we reach big fitness and then never have to do it again. But that's not life, and that's not what happens. And humans are inherently lazy. We never used to know where our next meal was coming from, so we don't want to expend energy if we don't have to. Now I'm reframing it and saying, this is not going to be rehab. So if you need to make sure that you go for a 1 kilometer walk every day so that your knee works, that's now your lifestyle. Your lifestyle is, I get up in the morning, I have my coffee, and I go and take the dog for a walk for an hour, because That's what keeps my knee working. It's not rehab anymore. It's actually my life. And so that's the two big things I've taken on board kind of in the last couple of years to make a difference in how people perceive it. And therefore, they tend to be a lot more accepting of it when you reframe it like that.
That's so true, because it's a behavior change. It's a habit change we've got to work on. And that's what I found. I tend to say to people, let's say when they've done or gone through their rehab phase and we're looking at that self-management phase, I said it's not something that you do for a couple more weeks. It's not self-management now. It's just like everybody, you've got to keep yourself fit and strong, otherwise things will go backwards, injury or not. And I think what has been really beneficial with the way that you do things too is you also, it depends on the situation, but you give people a period of time prior to surgery, not just from a rehab point of view, but to start to develop those behavioral traits and those behavioral patterns, not just from start doing some exercise, but from, start looking at diet, start looking at framing it into your day, start putting your, framing that new mindset of where can I incorporate this into my life, so that when things are already, they're hard because they're, pain and they're pre or post operatively, when things are probably at a very difficult point, those habits are a little bit more normal by that stage.
Yes, I mean, as you say, it's interesting you say that pre-hab as opposed to rehab. So there's been big moves all over the world about making sure that people are fitter for surgery. And, the classics are, hip replacement, knee replacement, ACL reconstructions. They've all got to get, it's a kind of red flag to try and operate on somebody who has got a really stiff knee after an ACL injury. So you have to make sure that they're fit and ready and active to have the surgery. And yes, it can be painful beforehand. But me, like being brutal about it, I stick knives in people. I use saws and saw pieces of their bones off. That's gonna hurt. So it's not like a miracle cure where all their pain goes away and everything's, sweetness and light afterwards. So they're still going to have pain afterwards. And so they have to be accepting that they will be working through some pain after surgery. And so if we can get them starting to work through that pain before surgery, then they're on the winner.
Yeah, that's so true. So when it comes to, you mentioned about how, I really like that idea, keeping your bag in the gym room to say to people, this is your routine, you're showing by example. So that's actually a really good tool. But would you have any tips or things that you've found when someone's saying, how do I start making those behavioral changes? Do you have any tips that you recommend to people?
The problem is that, everything that people come out with sounds like a platitude and sounds like a bloody a Hallmark card, So, but they're also true. This is the problem. So the phrases I would use with patients is we're all aware that, these things are hard. It's not easy. Whether it's a weight loss journey, whether it's a rehab journey, whether it's a recovery from surgery, it doesn't matter. They're all hard. None of it's easy. So first of all, we have to accept that. The second thing is, and again, it's one of those truisms, the hardest step that you ever take is the one that goes through the door. So if you need to go for a walk, you need to step out of the house to do that. If you need to go and rehab your upper body and you need special equipment, you have to walk into the gym to do that. So what's there, and look, everybody has bad days. Everybody has days where they just don't want to be there. And there was a really good TikTok last year or year before us, where there's a guy who was talking about how he had to go for a walk for his mental health. And he's like, I hate going for walks. Every time I get up in the morning, I hate going for my walk. And he was a bit more sweary, but basically by the end of it, he's going, and then at the end of it, I realize how good I feel having gone for a walk. Why the hell can't I just remember that it's good for me? Why do I always feel bad before I do it, but good afterwards? And that's true. Like for me, My happy place, if you like, is when I'm at the gym. If I'm lifting something heavy, I can't think about, the less than perfect interaction I had with the patient the day before, or the complex surgery that I'm worried about for the next week, or the patient that I've had to send to somebody else because they've got a special kind of cancer that I can't treat and I'm worried about. You can't think about that if you're lifting something heavy. So that mental space that creates is important. Now, there are days when I've had a bad night's sleep because I've had a difficult day, the case before, and I don't want to go to the gym. I'm just over it. I'm tired, I'm grumpy, and I don't want to be there. And I just, every time I walk out, I think of that guy on the TikTok and I'm like, he's bloody right. You go there and it's like, you do feel better afterwards, right? One thing to avoid in that, I guess, if you're genuinely unwell, don't go. But also, the other thing when I tell the patients is, look, I don't expect things to hurt. So when they're going to do their exercise, their rehab, whatever, it shouldn't be painful. If I go to the gym and I come out and I haven't broken a sweat, well, I haven't done enough. I should be uncomfortable afterwards. But what I shouldn't be is walking out of the gym going, my shoulder really hurts, or my knee really hurts, or my back really hurts. That's wrong. So, and when you explain to people the difference between being uncomfortable and being in pain, most people understand that there's a clear difference between the two, and they're allowed to push themselves into being uncomfortable. Because if they don't, they're not doing enough.
Sometimes it's just a matter of starting. Like you said, just walking out the door. It doesn't need to be. I think one thing that I've found works well with people is you don't need to start at 100%. You can aim to get to your 100%, but if you simply start at 20%, 1%, 20%, and you increase by 1% every single day, you will get to exactly where you need to be. And I think it's having that goal in mind of what you want to achieve, but also understanding what it means if you don't do things, if you do things, because it's not, if you put in the right behavioral practices, you will get to where you need to be. It's just a matter of time. But it is, like you said, for everybody. It's sometimes things, there are so many different things. It doesn't, like I never struggle. I would honestly say if I did, but I never struggle to not want to go to the gym. I love it. Even when it's never occurred to me that I don't want to go. But in other parts of my life, there are definitely things that I really don't want to do. But it's once you've overcome that, you get that positive reinforcement associated with it. So then you do it again a little easier. Yeah, it's so interesting. So when it comes to, you mentioned before about gym and not expecting, or there's a clear difference between discomfort and pain. What would you say are some good pain management tools that some people could take away from today?
Pain management tools. All right. Okay. So the vast majority of pain management tools should be non-pharmacological, right? We don't want people on medication, right? There are, so the simplest things is ice packs, and seeing somebody like yourself with a deep tissue massage for releases as they need to be done. Stretches. So I know I'm terrible at doing them, but they should be done. So getting enough sleep is important. So if you can't sleep, so there's been studies where if you have interrupted sleep for, I think it was either 8 or 9 days, people start getting spontaneous pain in just random muscles, no reason at all, other than they've had interrupted sleep. So those two things can feed off each other quite well. In other words, if you've got pain, which means that your sleep is broken, then your pain is going to feel worse. And that's where it comes to the difference between some pain being a biological response to a bad stimulus. So, and that your patient's going to literally be brain dead and have a pain response, right? That's how we check. But suffering is the mental aspect of the response to pain. So the suffering increases massively if pain itself is not managed in a way that's acceptable, if you like. So simple things, Don't do stuff that really hurts, because it'll really hurt. And if you know it's going to hurt, you shouldn't be doing it. So again, it's not uncomfortable. It can be uncomfortable. You can push through some things, but don't do stuff that you know is going to really hurt. And then when you do get pain, simple things like, if you need to rest, make sure you take a rest. If you need to use an ice pack, use an ice pack. Please don't use heat packs. You get so many people who come in and say, "Oh, but it feels so nice." Yes, it does, because it's it increases the blood flow there. But the problem with that is it also increases the blood flow, which increases the swelling. And so longer term, it takes more time for things to heal than if we just use simple ice packs. So ice packs, rest when you need it, get some sleep, just simple stuff first. You can use deep breathing. You can use like meditation as well to take your mind off things. Distraction therapy is a great one. Netflix if you want, whatever works. Something to distract you from the pain.
One thing that you mentioned really well before when you said about the pain stimulus it's a biological thing, because that's how we can sometimes check a response. But then you said the suffering component of pain. So I really liked that there's a difference between pain and suffering. And that's the thing that you can approach from different aspects as well, to do with regulating that nervous system, whether it be Netflix, whether it be reading, journaling, going for a walk, getting outside. That's that mental aspect that we want to consider as well, is the suffering component of pain, because no one ever has pain and goes, "Oh, I love this. This is a great experience. This is exactly what I want." But sometimes there is going to be situations where it's inevitable, but the suffering component is the thing that we can change and apply those different tips and tricks to. So I really like how you put that.
So yes, I mean, there's a couple of classic examples of that. Childbirth is one, very painful, but most people don't feel like they're suffering because there's a good reward at the end of it. And the same comes with surgery. It's like, yes, there is some pain, but because there is a reward at the end of it, most people don't feel that they're suffering with surgery compared to how they suffer with an illness. And then the opposite is true of rainy days. So it's good that you talked about journaling. Journaling is a classic, and that's specifically really good for coming back to mental resilience. That's a really important one for mental stuff. When you look at people's journals and their suffering, and people say, "Oh, I know it's going to rain. My knees always hurt more when it's raining." If you ask them to document how bad the pain is, it doesn't change. What changes is their perception is heightened, in that they can't go outside, they can't walk the dog, they can't do what they want to do. So they are thinking about their sore knee more often. The pain's the same, but they're suffering more. So yes, it does hurt more when it's raining. But that's because you're not distracting yourself with the other stuff that you want to do when it's not raining.
That's so interesting. And that's where something like journaling can be really helpful, is when someone can actually take a step into like a third person and understand that that's what helps someone with managing that suffering component of their pain. That's so interesting. I actually never knew that.
And then there's the other thing is, especially when you come back to the mental side of things, different ways of, when you have to write down how you feel and why you feel like that, it definitely helps you, because you're analyzing it from a more cerebral level. You have to take some of the emotion out of it, and by taking the emotion out of it, that's therapy. That's what you're doing. Is you're already kind of reducing that heightened response, because you have to figure out how to put it in writing. And you can do it in writing, you can do it by voice notes, you can do it however you want, you can draw pictures, it doesn't matter, as long as you have some way of expressing how you've been feeling. And then when you've gone through a bad event, or when you've gone through a bad experience, sometimes it's actually worth going back to those journals and those experiences and going, because again, the brain is designed to forget pain. Right? Otherwise, we would have one child per couple, and that would be it, because nobody would go through childbirth twice. So we're designed to forget pain. So you have an adverse event, and then you hurt yourself again, and you go, "Oh, this feels much worse this time." Or you have one knee replacement, and the second one always feels worse. because you think that the first time you've got no perception of how much it's going to hurt or whether it's going to hurt at all. Whereas the second time, you think, oh, well, I've got through the last one okay, so it must be good. And then it hurts even more because you've lost that sense of relativity. So by making a journal of adverse events and adverse times, it is worth sometimes, even in your happy days, I'm not saying, you're too happy, go away and feel sad again, but I'm just saying it's worth actually thinking about going back and going, I need to hold on to being happy now because this is how it can be. So you can feel happier reflecting on the fact that times aren't always happy. It's the old Persian saying, this too shall pass. So when you're sad, don't worry about it too much. When you're in pain, don't worry about it too much. It should pass. But when you're happy, make sure that you hold on to it. And when you're pain-free, enjoy being pain-free. And the fact that you can move, the fact that you can, go to the gym, you can dance, you can walk the dog, you can do whatever you want to do, because that will pass, and something else will come along that will interfere with it. So holding on to those moments when you can and letting go of the moments that you don't need are both just as important.
It's quite interesting. I would say 3 nights ago, I do a lot of journaling, and this is what I dove into that night in my book. And I was looking at it and I'm thinking, good and bad times will always happen. It cannot forever be good and it cannot forever be bad. Every negative time will end. It will, whether it's a week, 2 weeks, a month, maybe even a few years, but it will. You cannot have good without the bad, and you cannot have bad without the good. It's like that, what do they say? You can't see stars unless you have the darkness or something like that. But I guess from that, it gives you the two distinct perspectives of when things are negative, what can I learn from it? But knowing that something good is coming is almost exciting. But then when things are good, it's being aware and it's being grateful for that, knowing that you are prepped for, when things do kind of go bad. So it's just kind of interesting. And the way in which I find journaling really helps with that is it gives you perspective. It's one thing that you can't really see unless you take sort of a look down. And that's where I found, like, using a rehab diary with my clients is that it gives them perspective on their rehab, which they lose sight of because pain is that form of suffering. It can be that bit of a dark cloud that makes things a little bit blurry and a little bit confusing, and everything feels the same in that point. So if we can take away that dark cloud, you can kind of see everything a little bit clearer.
And that's the advantage that we have of not seeing patients that often after surgery. And it's a deliberate ploy because we'll see somebody, let's say after shoulder operation, you see this when they forget that they've left hospital on pain medication with ice packs, dosing themselves up, to be able to do what they need to do. And then they come back at 6 weeks and they go, oh, it's still a bit sore. And you go, are you still using the strong painkillers? Well, no. Can you feed yourself? Well, yeah, I can feed myself now. It's like, well, all of these things are progression. But because they happen so incrementally over time, that you have to have perspective to be able to determine that. And that's why we don't see people every week. It's like, because the changes will be so incrementally small that everybody gets disheartened. Whereas when I see people after 6 weeks, oh, well, you're looking fantastic. You're looking so much better. So you can reassure them that.
Exactly. And when we have that perspective, it gives you a bit more clarity around the difference between feeling and then the difference between emotion, because you can have both and they can be a little bit different, but one of them is more practical than the other. So when you've got that perspective, you can shift that perspective between feeling and emotion to then, an example that I'm kind of leading with this is, let's say you are in pain, but you are feeling really good. That's going to put you in the right position to then go, I can still go to the gym today, even though I'm in pain, but I'm feeling really good. So, but then on the contrary to that, if you're in pain, but you're frustrated and you've had enough and what am I doing this for? I'm not going to the gym because it's a waste of time. All it's going to do is put me in pain, and add that emotion to it. That's going to then change our behavioral response. So it's really quite interesting how if we actually do not consider it, it makes it a very difficult process. And just one thing you said before, and this is just a personal thing, is when I was when I made a rehab diary, and I was in that sort of 2 to 3 years of my life, and it was in a time when I was in a domestic violence relationship. And where I'm going with this is, when I look at things now, I cannot, you're in a form of, let's call it pain, suffering, whatever you want to call it. I cannot remember those 2 years of as my brain has forgot it. It doesn't need it. It doesn't want it. It forgets it. So when I put it into perspective like that, it's not that I'm carrying around this weight of that situation in a form of, pain, but my brain has literally gone, that was it's insignificant. You don't need it. You are well past that now. Here's new experiences. So it's just, when you said that, it just got me thinking, I don't remember, but it's also because I don't need to remember. It's not going to benefit me.
So I'm glad that's happened to you. The problem is it doesn't happen for everybody. That
Exactly.
We get lots of patients who are DVA patients who've got PTSD, whose brain is now wired to relive those adverse events. So they can't remember, they can't forget it. They can't get away from that environment. So they have to learn different techniques to be able to cope, and different ways of being resilient, if you like, to the effect, to the events that have and the experiences that they've been through. And I'm going to have to reflect one thing back to you. I would say that no domestic violence relationship is ever insignificant.
No, and don't get me wrong, it takes work and tools. I wouldn't definitely be in that position if it wasn't the right work and tools, and essentially it's a form of rehab to get to that point. But what's possible when you can is in your favor.
Yeah. So that kind of traumatic environment, I agree, doesn't have to shape you forever, but it's just like going to the gym. If you don't take the step to the therapist to do the work, to do the rehab mentally, then no, you won't improve, you won't get better, you'll be stuck in that thing. And I'm not saying that our veterans are doing that by choice. Sometimes you can't face it, and that's a terrible situation to be in, and that's why we have to offer whatever help and support we can for people like that. There is always a light, whether it's, I'm not going to say the whole train at the end of the tunnel thing. There is always a light. Sometimes it's a long way away, but you can get there with support.
Exactly. Yeah, that's so true. Do you find then, with that being said, if somebody has had an experience in their life, so let's say they've hurt their back and it was quite a significant moment in their life, or they've hurt their knee or somewhere, it doesn't really matter where, they've hurt themselves, and it was a terrible experience, as in from a therapy point of view, it was terrible, from everything, it was terrible. Do you find that the mental state that someone, or the mental experience that someone has had, can affect their future experiences?
Oh, absolutely. It colours everything. We're all built from our memories. So you've learned to put to one side memories that, if they were there all the time in your forefront of your mind, would be harmful, distracting, hurtful. And so you've done the time and had the therapy, and you can put those to one side. So we just need to support people who have difficulty doing that, because one of the kind of diagnostic criteria for post-traumatic stress is that, you get flashbacks and you can't control it. So we have to look at different ways of managing those events and managing those experiences, to allow those people to be able to function, to be able to work, to be able to rehabilitate. Yeah.
I heard something the other day. It just kind of clicked in my brain, but it's like, there's only one thing ever, and that is our brain, that can take you back to the past but also propel you to the future. And that is our brain. Nothing else in this world can do it. And I was like, wow, that's actually really interesting, because when it comes to our thoughts, when it comes to our previous experiences, that's going to shape not only our emotional response to what's going on in the present, but the behavior patterns that we put into place. And I guess why I wanted to speak about this with you was to give some context, understanding to people around that during these big events in their life. So it's so interesting. So yeah, I can tell from that when it comes to your practice, the holistic component to you it's extremely important. And I think that's why I really like working with you as well, is because sometimes, unfortunately, it can be overlooked, but it is the way that someone's feeling is literally the reason they're there in the first place. And even if someone, let's say in our perspective, there's no clinical reason that they should have pain, and they do. So it just stems a lot bigger than than anything that we can just, I guess, clinically approach. So yeah, I think that holistic aspect to everything that you do, I think that's the difference between someone hitting that 100%.
Yeah. Oh, look, and it comes back to what you were saying before about the attitude of people who are in pain, and whether they're in a more negative emotional space and therefore don't want to deal with it and don't want to do anything about it, as opposed to in a more positive emotional space where they are feeling that they're going to do things almost in spite of it. But going back to that, people don't even need to be in pain. If you are depressed, you have terrible anxiety, you won't want to even leave the house to do any exercise or to keep fit or to do anything or to get out of bed or to shower or look after yourself, because the emotional pain is so great that you can't even face doing simple tasks. And that can be whether you've got a physical stimulus to that or a physical insult that started that or not. You don't have to have a physical insult to start that.
Yeah, exactly. The last point of just sort of this topic that I wanted to touch on before we kind of get onto the last final topic is, and I've spoken to a few people I've had a few podcasts, and I asked this question because it's interesting. And I know that a podcast that I've got coming up with a fighter who is in the UFC, his approach, that's what's at the forefront of my brain. So I'm interested to hear yours. How important do you feel support systems are when it comes to not just rehab, but I guess adversity in your life or doing tough things, or how important do you think support systems are?
So the CDC, the general surgeon, I think he's called in the States in 2022 or 23, declared loneliness as a national epidemic of illness. So there's worldwide acceptance that support networks are crucial, basically. Going back to what we said about before about moving, so many times to so many different towns and so many different hospitals, so many different cities. The joke amongst doctors is that basically it's like trauma bonding. You turn up at a hospital, you're the best friends ever for 6 months, and then you never talk to anybody again. But you have to have those networks locally to go through those intense times, and getting out. And then you've got the contrast between being lonely and wanting to meet people, but how do you go about that in an era and a time now where the vast majority of people under the age of 40 will be trying to find somebody using a cell phone, and the irony of trying to find a personal collection on an electronic device is not lost. So that support network thing, it's invaluable. I mean, you should try and find people that you trust, and you should try and find people that you can talk to. It's the "Are you okay?" moment. Like you need somebody who you can talk to.
It's interesting because one thing I say to clients, or one thing I say to people that I've learned from podcasts myself, is people, like humans are people. We're meant to be in a tribe, just like there might be some animals that are meant to be in a pair and some that are meant to be in a school, but humans are meant to be in a tribe. It's part of our natural instincts for certain different reasons. And if you're not, it can, in some cases, and this is where it's probably backing onto what you said about the did you say global loneliness is now global? Yeah. Um, yeah, well, when you are alone, and way back when, that would have triggered the survival instinct because you don't have people there helping and protecting you. So naturally, your body goes into I need to fend for myself, and it kicks into that panic mode, and that can stimulate our nervous system. It was just really interesting listening to it, but it's I also got another perspective, like I said, from this the UFC fighter that's coming on, that I'm not going to go into detail because it'll give too much away. But there is a difference. I think there is a difference between being lonely and then being in solitude. And there's a difference between having that inner strength in yourself and then relying on other people around you. Is you can't, you've got to have that intrinsic motivation, not just the extrinsic support. But it's so true. I tend to find that with my clients, if they have a form of supportive network around them, the progress that they make tend to be at a much more comfortable rate because they are managing their emotions, their feelings, which the importance of that I spoke about before, at a much more what's the word? They're doing it straight away. They're not letting it get on top of them. So the rate in which they're progressing is really quite nice. But I think when it comes to anything to do with, hardship in life, I know I probably wouldn't be where I am if I didn't have my supportive group around me. So it's interesting.
I think a big part of that as well is you do have to be not confident, but you need to be comfortable in your own skin. If you're not comfortable in your own skin, people will be uncomfortable around you because they won't be, they'll sense something off, basically. So you have to be able to be alone and not worry about being alone to then be good company, because that way you're not clawing or trying to cling on and say, oh, like, talk to me, talk to me, talk to me, because if they don't talk to you, that's okay because you're comfortable in your own company. So there is as you say, there's the two aspects to it. There's somebody can be in the biggest crowd in the world and still feel lonely because they haven't come to terms or come to internal happiness, if you like, which I understand is starting to sound very philosophical, but yeah.
No, it's so true. I know. I was like, oh, I could totally talk about this all day because it was funny. What I said before about, how I said people are, humans are people, and we're meant to be in a
Yeah.
tribe. But this day and age, people spend more time trying to impress the thousands of people they might have on their online profiles when no one cares. And the only person that's actually, or the only I guess benefit to our emotional system is going to be from those people closest to us, yet we don't even consider those relationships, but they spend more time trying to impress other people that have nothing to do with our circle. It's so interesting.
Yeah.
But little tangent there. But so to finish us off for today, I just wanted to talk to you a little bit about some of the sort of new things that you've been working on when it comes to surgery. I had the pleasure of sitting in with Chris and seeing some amazing stuff with the robots they're doing. Tell us just a little bit, touch on that and what that's doing for surgery and how you're seeing the benefits of recovery and yeah.
So, I mean, like every phase, you hope that things improve with the new things that come along. The robotics certainly gives us an extra, it basically gives me mental headspace. So instead of my brain thinking, am I holding this saw in the right way to give this patient the best angle, the best whatever, it allows me the mental headspace to not have to worry about that. So I'm not thinking about that anymore. What I'm now thinking about is I know I'm going to get the cut right. Therefore, I can then focus all of my very meager brain power on making sure that the cut itself is the right angle for the patient, not whether I'm actually going to be able to achieve that. So it takes that stress away. The robot and certainly with hip replacements, for instance, the 3D modeling that's available for us now vastly reduces the risk of that hip replacement dislocating, which historically was one of the top three reasons for actually taking one out and doing it again, which is obviously a massive undertaking. So we can minimize one of the top three risks globally for having to redo surgery, then I think that's a winner. The problem is that the results that I'm hoping to get, I won't see, because hip replacements last 20 to 25 years. Knee replacements should last at least 15 to 20 years. So all the work I'm putting in now is going to benefit somebody else. It's not for me, it's for that patient, but also as a philosophical guide, for instance, I tend to put implants in that are shaped very closely to fit the bone that I've cut. So we don't use any kind of glue or cement on most people, right? Now, if somebody's got really soft bone, then we'll use the glue, but most of the time we don't. My complication rate is going to be higher because I don't use the glue. So this is not to my advantage. It would be easy for me if I just glued them all in, and then I wouldn't have to worry about it. But there is a recognized risk somewhere between 1 in 200 and 1 in 100 that the bone doesn't bond onto these components, and therefore they have to be taken out and again. And that's painful. It's a second surgery, all of those things. But most patients have a lifetime risk of 1 in 10 that will wear out in their lifetime and need done again. And then what you're talking about is that's a tenfold increase, statistically speaking, on the number of patients who need it done. And taking one out that's been cemented in causes far more trauma to that patient than taking out one that's not been glued in. And that's at a time when that patient is 20 years older, they're 20 years less fit, 20 years more infirm with regards to their disease burden. So this is no way benefiting me because, as I say, my complication rate goes up by doing this. But what it should do is benefit this cohort of patients that when I'm retired, fingers crossed in 20 years, that they then see somebody else who goes, oh, thank goodness, this hasn't been cemented in. That'll make it much less stressful on you as a patient. So the robotics allows us to lean into that a lot more, a bit more. And then the other things that technology, so things that are advancing. So it used to be that knee arthritis, there was pretty much not much available. You could do medication, lots of rehab, exercise, injections, and then pretty much if you'd exhausted them, all you've then got left is surgery. And keyhole surgery doesn't make any difference long term. Don't get me wrong. Somebody's got a big lump of something blocking movement in the knee or catching in the knee. Yes, we can get rid of that, knowing that that may come back because of the wear and tear process. But there wasn't really much between like keyhole surgery, which we now don't do, and knee replacements. But now we've got techniques where we can actually numb some of the nerves around the knee. So if somebody is in their early 60s, they just want to get through until their retirement fund matures at 65, and then they'll have their knee replacement. There are now things that we can do where we can numb the nerves and it reduces their pain. The best way I found of describing it is it turns it from being screaming and shouting to just having a quiet word. So you know it's there, it's not disappeared completely, but you can actually tune it out. And that will last for a year or two. So those kind of techniques are now we're also doing locally as well. So there's all these things, there's a classic phrase that was popularized by Newton, which is that he was a he was a dwarf standing on the shoulders of giants. He could only sink further because even though of all the people that had come before him, right? So, and that's the vast majority of surgeons are like that. the vast majority of doctors are like that, or physicians, clinicians. Very rarely do we invent something new that revolutionizes medicine at this stage. Right? What we do is we take what everybody else has done and we try and do it to the best of our and their ability so the patient gets a good outcome. But I didn't invent any of this. I didn't invent, the needles. I didn't invent the joint replacements. I'm just grateful for the guys who did, so I can then offer it to people in a way that works for them.
Yeah. And then continue that kind of advancing process. And would you say what your goal is to achieve as a surgeon, would that kind of align with that statement?
Only partly. There are lots of aspects of medicine and surgery and treating people that comes back to that holistic approach that we do not cover well in surgery at all. There are lots and lots of hip scores. So somebody's got a bad hip and you give them a treatment, then their hip feels better. But there are very few to no scores of how a patient feels about how they've been treated by a doctor. Like, were you looked at? Did you feel looked after? Were your boundaries respected? Was your cultural issues accepted and respected? In surgery, there's very, very, very little to do with that. And yet, if you were to go to the Royal Australasian College of Surgeons website, the core clinical competencies for a surgeon, only 2 of them are directly related to medicine. One of them is technical competency, in other words, can you do the operation? And the other one is medical competency, so do you know what operation to do? And then there's clinical decision making, like, does that patient need that operation? Or is it more appropriate to do something else in that circumstance? But only 2 or 3 of them are actually about the direct act of scientific medicine. The others are all about collaboration, teamwork, communication, cultural issues. And those are the things that 70 to 80% of our competencies, but they're not well understood or able to be measured and therefore improved.
Interesting.
That's what I would lean towards. The less technical aspects is what we need to work on.
Yeah. And I think with that, if we can provide services or master that side of things a little bit more, that's where, like you said, I think then the future of them, what comes through, leverages from that and it allows that to advance. But I think, everything that we've just spoken about, if we can, dive into that and focus on that a little bit more in conjunction with the competencies that are already, that standard that's already there, I think that's going to be where some big changes are going to come from.
Yeah, that's what I'm hoping.
Yeah, that's incredible. Well, thank you so much. Honestly, like I said earlier, I have the privilege of being able to work alongside you and learn alongside you, and it honestly continues to evolve and change. And I think the one thing that I really do find that sets you apart from general situations or general medicine is the fact that you have the awareness, the knowledge, but the ability to want to care about someone more than just the knee or the bone or the this or the that. So I think that's the biggest thing, where you find, if somebody can have a good experience and achieve functionally what they want to achieve, it's not only going to be beneficial in that moment, but it's going to be a situation in their life that not only makes physically stronger from what you've done, but mentally a much stronger person too. So I think that's just incredible what you're achieving in that space, and with all the future stuff that's coming with what you're achieving is quite amazing. So I'm keen to see it all. So thank you again so much for being a part of this, and yeah, thank you for your time.